Good evening, everyone. Thank you for joining us this evening for our webinar titled Fertility Treatments in COVID-19, Your Safety Above Everything Else. I'd like to start off with introducing our speakers for tonight's webinar, Dr. Geeta Venkat, Director and Senior Consultant, myself, and Darshi Karuba, our Head of Donation. So on to the agenda. First, we would like to discuss the impact of COVID-19 on fertility treatments in the UK. As some of you may not have been through treatment before and may be curious as to what's occurred. Then we'd like to discuss how we're making the clinic as COVID-free and as risk-free for both our patients and staff as possible. Then we will go on to explaining how our fertility checkups have changed and how we have adapted in view of COVID-19. Following on to the new patient pathway and patient care and support. And then lastly, I'll be discussing coping with the emotional burden and the code of conduct. And now, without further ado, I'd like to hand over to Dr. Venkat.
Thank you, Karina. Welcome, ladies and gentlemen. Thank you for joining us. Okay, so this COVID-19 has been taking over our lives this year, as you all know. And so it interfered with our fertility treatments, fertility clinics management. Therefore, in March, you might have heard the government put a complete lockdown, and our regulator, Human Fertilization and Embryology Authority, sent an email to us saying you must stop the treatments from March 23rd, and we had to stop the clinics. What it meant was we were not allowed to start any new treatment. However, we were allowed to complete the treatment for the patients who had commenced their treatment. And then we didn't do any treatment for 2 months, and we were allowed to restart from May 2020. From May, we started calling the patients and preparing the clinic for treating the patients with safety. The next point, you can see that the Human Fertilization and Embryology Authority informed us that we must put in place a new COVID-19 strategy to minimize the risk of infection. So we had to prepare all our SOPs and get the clinic ready, because we had to make some changes and make the PPE available, and then we could start. So we were able to start from 1st of June, and we started our treatment. So what was the aim for this COVID-19 strategy? Basically, we wanted to minimize the risk of infection to the patients, that is you and your side of the people, and minimize the risk of infection to the staff from the clinic side as well. Therefore, we have to protect both sides. And we also prevent this infection, preventing the infection to the unborn baby. If somebody gets pregnant from the treatment, the baby could be potentially infected. Therefore, we are saving a third individual there. That's why it's important to reduce the risk. And lastly, this is not about COVID-19. We were advised to reduce the risk of admission to the hospitals in general by people having hyperstimulation or overstimulation during the fertility treatment. And following the fertility treatment, some women do have ectopic pregnancy and they need admission. So we were advised to reduce the incidence of these complications from IVF treatment so that the hospital beds could be used for the COVID-19 patients. So what were the changes? Then when we reopened the clinic, we offered only selective treatments. We didn't offer all the treatments. So we started doing stimulation and egg collection for the patients. We didn't put the embryos back in because we were not sure what will happen, whether the risk was going to be high, risk of miscarriage was going to be high. And then we attended webinars, and people had done research by that time and found that there is no increased risk of miscarriage because of COVID-19, and also the babies were not affected so much by COVID-19. Hence, subsequently, we started doing the embryo transfers, and now since 3 months, we are able to offer all treatments, including immune treatment, after we wrote to the Human Fertilization and Embryology Authority. Now, we are going to talk to you about keeping the clinic COVID-free. I'm going to hand over to my colleague, Darshi.
Hi everyone, my name is Dashi. Thank you, Dr. Venkat. So I'm going to talk about in these slides how we are going to keep the clinic as COVID-free, because you all might be wondering, oh, is it safer to start the treatment and everything? So Dr. Venkat mentioned about few things what is involved as a individual, but I'll just go through how we are keeping the clinic. So instead of having face-to-face appointments, so all the consultations, appointments and everything, we are doing it remotely. So online, video call, Zoom, anything like that. And if you are having an appointment in the clinic, then we actually wanted to do a pre-screening questionnaire, and which is the like basic questions about, do you have any fever, are you coughing? So these are the basic questionnaire we ask to make sure you are free, safe. And then when you're in the clinic, before we start the actual treatment, we will do a swab test. So this is to test the COVID test, so to make sure, because if you're positive, then we can't. If you're negative, then we can go ahead with the treatment. Like Dr. Venkat said, it needs to be reduce the risk, so that we have to consider about the third individual. Also, compared to before and now, we have fewer appointments during the treatment. So we minimize the appointment. It doesn't mean we have compromised in the treatment. It is about how we monitoring you. We have changed a little bit in the system. And other thing I wanted to mention to you is we are not encouraging any visitors. So if you want to come, someone come along with you. We are not encouraging that in the clinic at the moment due to the risk as well. Okay, now this is very common, as we all every day is getting used to it, the PPE. So the staff will be wearing PPE in the clinic, and we expect the patients who's coming to the clinic to wear as well. So the desk, all the area of the desk, we have staff involved with the patients. Most of the places, we have screen involved, unless if it's a scan, that's a different, but otherwise screen are involved in place. And the appointment, instead of having a short appointment, we have allowed time a longer appointment, so that we are not increasing the infection, so we are decreasing the contamination. And also the use and single-use disposable items at the moment, because again, try and avoid this, like such as plastic cups, including gowns and beverages and everything. So staff as well as the patients, we are trying to single-time use only. And also in the waiting area, we have put the spacing out chairs and everything. So mostly we have covered most of the things, what we can do COVID-free. I will now pass on back to Dr. Venkat again. Dr. Venkat.
Thank you. Thank you, Dashi. Okay, right. Before COVID-19, or nowadays we should call it pre-COVID-19, we used to do everything in the clinic. All the patients came to the clinic for consultation. We performed all the investigations like blood test, ultrasound scan, and then we wait for the results. Subsequently, we arranged all the consultation, that is follow-up consultation to discuss the results. It is all happening in the clinic. And the gentlemen, the male partners, did their semen analysis in the clinic. They produced a sample there, so the fresh sample was analyzed by our embryologist, and the report was produced on the same day. Either the doctor or the embryologist explains the results to the patients. So everything was happening on the premises. Thank you. Thank you, Dashi. Okay, right. So that is the pre-COVID. You can see on the left-hand side of the slide, that is all personal, everything happened on site, then consultations on site. Now, since COVID-19 time, all the systems have changed. All the consultations are performed remotely, either by telephone or Zoom or Skype and or FaceTime. So we do all the consultations remotely, can be video or telephone. Subsequently, the couple are advised to come to the clinic. Mainly, we request only the female to come to the clinic for an ultrasound scan and a blood test to check the hormones, reproductive hormones, and that has to be done on site, so it's performed at the clinic. And the male partners are given the opportunity or the choice to select one of the ways of testing their sperm. They could do it at home, so we give them a home test kit, which is very simple to perform, which is attached to either the phone or the computer, and it gives the result. They can see the video of the sperm moving around, which is quite an interesting sight for them. Or if they want a comprehensive analysis, or if somebody knows that there has been a problem with the sperm and they needed a detailed analysis of the sperm, then we advise them to come to the clinic and produce a sample, and we did it. And after all these investigations, again, the follow-up consultation is arranged remotely, either by video or by telephone, whichever is suitable or convenient for the clients. Okay, so we discussed about the female, and this is a couple of words about the male sperm test. And this is a new test. It just been developed. We developed it 2 years ago when I went for a conference in Dubai, because they asked me to present all the new gadgets which are used in fertility, and we developed this so that men can do their sperm count or analysis at home, because you think that with no disrespect to the men, we think there's only one test they have to perform, whereas females have to go through so many things, but they always find it difficult to do this. So I sympathize with them. And if some of them find it difficult to do it in the clinic, especially if you are going to ask them to produce the sample, it is very stressful for them. And we tell them, look, if you would like to do it at the comfort of your home, you are most welcome to do it. And if they can do it at a time that's convenient for them, they don't have to come to the clinic. And sometimes they come after work and busy day, and they are so tired and exhausted, therefore they prefer it. And in this one, it's a simple basic test, which is good enough. And there is a device which has to be attached to the phone or the computer, and there is a slide. So what we do, we ask the men to produce the sample, we provide the pot in the kit, and they take 1 or 2 drops of the sample, put it on a slide, cover it with a cover slip, and attach the slide to the device. And the device, as I told you, is already plugged to the computer or the phone. It will work with only certain phones, not all the phones. Please check before, and then attach it. And it takes few minutes, and then it gives you the result with a video of the sperm sample on the phone or on the computer. And it will tell you how many motile sperm are there. And according to WHO criteria, it will tell us whether it's normal or below normal. That is the most important thing. Okay, now this is my turn to hand over to my colleague again, who is going to describe the new patient pathway. Thank you very much, Darshi, for taking over.
That's fine. Thank you, Dr. Venkat. So now I'll go through the slides about the patient's pathway. So if you see the patient pathway, so like I said, remotely you will have a consultation. So you will contact us, we will book the consultation. So it will be happening preferably over the video call, or if not, if you want a phone call even, you can do that. So then we have the questionnaire, like I mentioned, the questionnaire to say COVID symptoms, to find out whether you have any symptoms or anything like that. So if it's yes, fine, then we will book the scan appointment after that, and a blood test, which Dr. Venkat mentioned what are the things you might need to do. So, but if the symptoms are, if you have a symptoms, then we will wait until it's all clear and you have to come back. But if you do the scans, and then after the scans, then again you will have the results in hand, with the doctor. So she would have reviewed the results. Then we will have a follow-up consultation, which they will be arranged. So you will be discuss the options of the treatment and everything from there. So then you will start your treatment. So then when you start the treatment, again at the time, you will, before you start the treatment, we need to do the COVID test again. So again, if you're positive, we will stop the treatment there itself. Otherwise, we will carry forward. Then we will have, when you have the, like, it's like a process you can see in the slides, you can see the checkup, which we already spoke about, Dr. Mingat. So I have gone through the steps. And then the second week prior to the treatment, where we will do the COVID test, nurse consultation and everything, and some blood test. And then the third day of before the period, again, you will have the test. And again, if you're negative, we will progress to the treatment. If you're positive, we will stop again. And then start the actual stimulation. Again, at the stimulation side, even though we have done the COVID test, we will still have the same questionnaire again for you to make sure that you don't have any kind of symptoms and everything. Because like I said, we are getting the third individual who is going to be affected as well, not only you all. So therefore, we are very, very careful about creating babies if you don't have any COVID symptoms. Again, if you have, in the next slides, I'll talk about the payments plans, how it works if you are canceling a treatment in the halfway through. But then the treatment commence, you start the treatment. Okay, like I said, the patient and care and support. So patient must be trained to correct use of PPE prior entry to the clinic. So we will all do all this nurse will show you on a video call. And all patient will giving information about COVID-19 verbally as well as in writing. After discussing the COVID-19 risk, patient must be decide. You have to decide, because it's your treatment. You need to decide whether you want to proceed this at the moment or you want to have it a little bit later. It's up to you. It's your choice, or you can make a decision. And then also it's about, in the meantime, because it's so different about the situation and everything, you must be going through so many things. So therefore, we have the counseling availability for the staff as well as the patient. So anybody need, it's always the counseling service is available. And then the other thing is, patient must be advised about financially what we do. Like I mentioned in the previous slides, if you are going to have the treatment, well, let's say you have started the treatment, you had paid for the treatment and everything. If we cancel because of you have any symptoms or you are positive, or at the moment we never know what's going to happen in next week or week after. So let's say the government says, no, you have to cease all the treatment or anything. So if anything needs to happen, or if anybody infected or we had to shut down or anything like that, then whatever the service so far we have provided, we will charge you. The rest of the balance we will credit back to you. Anyway, and that's also fine this slide. Now I will hand over to Karina, who will take over from me. Thank you, Karina.
Thank you, Darshi. Hi, everyone. So I'm one of the patient coordinators. I may have spoken to some of you already, but I just wanted to say a few words about the impact that COVID has had on the psychological and emotional aspects of treatment. We understand that lockdown was difficult. It continues to be a difficult situation to manage. We're all taking it day by day. It has raised anxieties, mainly into the ticking clock and the longer wait times, and it's taken some of the time factor away, which is already quite precious, and amplified that. I know some of you may be worried about and feeling anxious about getting treatment or about waiting times, and I just wanted to emphasize that we will always do our best to minimize wait times where we can. We don't want to delay treatment any more than you do. I always get a lot of questions about timelines and when will I be able to start my treatment, etc. And the first step is to have a consultation so that the doctor can begin to plan your treatment, can discuss with you next steps. So please do get in touch with me if you're ready to take that first step, and we can discuss this further. I also know some of you may be worried about frozen samples and whether they have been safe. And yes, they are safe. And please, if you're worried about anything or have any questions, just get in touch with us and we're happy to ease your worries and answer any questions you may have. Another question that I get a lot is it okay to go ahead of treatment, or are you going ahead of treatment? And yes, the clinic is now open. We are proceeding with fertility treatments, and we're operating as normal as possible, and treatments are being performed safely and responsibly at all times. Also, as Darshi has mentioned, we do have a counsellor available. So if you are feeling anxious or worried, or if you would like to speak to someone, do let us know and we can direct you to our counsellor. So from a practical side, as patient coordinator, I'm here to help you take those first steps into your fertility journey and hopefully ease some of your worries and concerns. And as we've mentioned before, one of our top priorities is to ensure your safety above everything else. And one of the ways we can do that is to continue to have remote consultations in order to minimise the number of patients in the clinic at any given time. We also ask that you minimise the risk for both yourself and others by avoiding any unnecessary exposure wherever you can. We also understand that everyone has busy schedules and we will do our best to accommodate you. We do offer both early and evening remote appointments where possible, so just let us know. And if you're worried about anything, or if you have any questions, please give us a call or reach out to me via email, whatever you prefer. We are here to help you and to answer any questions you may have and to make your fertility journey as stress-free as possible. Right, our code of conduct. So as we know, the risk of COVID is rising, and in order to keep the clinic as safe as possible so that we can continue to provide treatment, we do ask that all our patients and staff adhere to our code of conduct. So that is identify the risks. So people, busy places such as hospitals, transport, as well as any odd objects or any hard surfaces which are near other people and any areas with high infection. We ask you to be observant, know the symptoms. So we know it's coughing, high temperature, difficulty breathing, or just feeling unwell. Also, avoid unnecessary exposure and restrict interactions in line with the government guidelines on social distancing and remaining at home. And then on to ACT. Only perform essential activities with minimum frequency, such as shopping once a week. When you're out, please make sure you wear a face mask, wash your hands well, make sure you have hand sanitizer with you. And finally, we ask that you inform the clinic if you've been potentially exposed or if you've got any symptoms. Just give us a call. Please don't turn up for any appointments. Just give us a call and let us know, and also inform others of your responsibilities. And as a clinic, we will always keep you informed of any guidance changes as well. And now I think we have a video from one of our patients that we'd like to share with you.
Our family. Our family.
We went to the clinic in, I think it was 2014, late in the year. Me and my partner have been together for quite a few years, and we were trying for a baby, but unfortunately it ended in an ectopic pregnancy, resulting in having a fallopian tube removed. After being told there wasn't any reason why we couldn't fall naturally, it was another 3 years later, we decided that we knew we had to consider other options. So we obviously went down the IVF route.
Our family. Our family.
We did some research. We came across Harley Street Fertility Clinic, having looked into their success rate, at reviews, and then obviously booking a consultation, and then obviously going along and meeting Dr. Venkat. We just knew that that was the place to go for us. After the consultation, we had a short protocol of an IVF round. The whole process, took over just over 2 weeks. My own eggs, my partner's sperm, we had 8 embryos. They were not graded that well, to be honest. The IVF treatment, they do like to leave them up to 5 days for the blastocyst, but mine didn't quite make that. So we had to have a transfer on actually day 2. But the staff were excellent. They obviously in contact all the time and letting us know what to do. Yeah, so we ended up having 2 transferred when originally it was only going to be 1, which resulted into my boy. The pregnancy went excellent. I did stay on some progesterone, I can't remember what it's called, Cyclogest, just to keep the pregnancy going. A healthy pregnancy and a very healthy 8 pound 7 little boy at the end, and it just went all smoothly. Yeah, it's really good.
How old is he now?
He's 5. He's 5 years old. He's happy, healthy, 5-year-old, typical little boy. And yeah, and I call him my little miracle man. If it wasn't with that, if it wasn't for them, I wouldn't have my dream come true. Well, without Dr. Venkat's help, with her experience and knowledge, she was just amazing. I don't know what I'd do. I don't know what I'd done without her. I wouldn't be a mum today. She makes you feel welcome. Everything was thoroughly explained into detail about all the treatments that were available and what's in, the best for you, best route for you. It was so relaxed and in a comforting way, and we definitely made the right decision with Dr. Venkat. She was so good. Marion was just so lovely to meet. She was so kind, and she's like a gentle person. She was so reassuring when needed. She was just absolutely lovely. I've never met such a lovely lady. Really nice. To women seeking fertility treatment, I would really highly recommend Dr. Venkat at Harley Street. You will be treated in such a comforting and confidential and dignified way by all the team and staff. I would highly, highly recommend. And who knows, I might go back one day myself.
That would be great. A sibling for life.
Our family. Our family.
All right, thank you. So now we'll take it to the Q&A, and we've had a few questions already. So the first question is, we've tried 3 IUIs and 1 IVF and ICSI. The egg was good and sperm was also good. Embryo was 3 cc, but unfortunately we had a failed IUI. Please could you give us some advice? Can we proceed to IVF, and do we need the change in procedures? So I'll pass this on to Dr. Venkat.
Yes. That's a good question. And if the IUI has not worked, I think it's time to move on to IVF to see the egg quality and how the fertilization is, because IUI is a very simple treatment. And if it doesn't work, we don't know why it hasn't worked. We can only say something about the sperm preparation, whether it has prepared well or not, and how many eggs you have produced, especially if you had stimulated cycle, that is with clomiphene or letrozole, one of the things to start the ovulation induction, and then we trigger the ovulation with the human chorionic gonadotrophin injection. That way we make you release the egg and then perform the insemination. So if it doesn't work, whether fertilization occurs or is it an implantation issue, we have no idea. That is why the IVF is a better kind of treatment, because it has got a higher success rate. And not only that, in case it does not work, we come to know why this has not worked. Where is the problem? Where is the issue? What can we do to make it better for you? Because we get more information about the egg and the sperm in IVF treatment, so we can modify certain things, make it better for you, and make it successful. That's all we want.
Thank you, Dr. Venkat. Our next question is, I am a surrogate and I would like to know how long sperm has to be quarantined. I've heard that it can be anything between 6 weeks and 6 months.
Yes, that's again a good, interesting question. Now, previously, the surrogacy cases, the sperm had to be quarantined for 6 months because we were doing the screening test by normal and conventional method, which indicate whether there are antibodies or not, which means there is a latent period of 180 days, by which time we know definitely whether someone has got the infection or not. Hence, we had to repeat the tests. That is, these are the blood tests to check for infections like HIV, hepatitis B, and hepatitis C. We used to repeat them at the end of 6 months. And once it's clear, then only we release the sperm sample for surrogacy treatment. Now there is a new test called NAT screening. That is, we directly test for the virus particle by PCR method. And if someone has got the infection on that day, we will be able to detect it. There is no need to wait for the 6 months or 180-day quarantine period according to Human Fertilization and Embryology Authority. So now they have put a new rule for any quarantine period regarding eggs, sperm, and embryos. So if anything is frozen, they want us to do this NAT screening, that is checking for the virus by the PCR method before we freeze the gametes or the embryos. And then at the end of 3 months, we are requested to repeat the test for the egg donor, sperm donor. Again, the surrogacy, it is the same. If you are freezing the sperm donor or the intended parents, that is the male partner, has to repeat the test at the end of the 3 months, and then we can do it. So that is how nowadays we do. So if there is a quarantine period of 3 months. That is the simple answer now, not like before where there was 6 months.
Perfect. The next question is, how long is your lead time for booking checkups at the moment? I think I can answer this one.
Yes.
At the moment, it's about a week. It depends. What I would suggest is give us a call. It usually takes, you can get an appointment towards the end of the week. So the other week, like I said, we will always try to accommodate you. We have early appointments available as well as later appointments available. So just let us know what would work for you. And like I said, we will always try to accommodate a time that suits you. Our next question, with COVID, are you still taking sperm donations from EU sperm banks, such as Cryos International in Denmark?
Yes, we are getting sperm from there. We have arrangement with them, and therefore we are able to import donor sperm from Cryos and then European Sperm Bank. And we also get from Zytex from US. So we are, and then of course we get sperm from the UK sperm banks as well.
And our other question, could having the coronavirus affect my fertility?
Well, this is a very challenging question for me, I think, and nobody has asked this question. Well done, whoever has asked this question. Actually, nobody knows, because now initially we found that the infection can be very severe. People suffer a lot, and mortality rates were also higher depending on the age and other complicating diseases the person has got. But this virus is not known to affect the fertility, that is ovarian reserve, because the eggs are in the ovary, they are not affected by the viral infection. Your viral infection is a systemic infection, so it does not reduce the ovarian reserve, so it does not affect fertility. However, if you get pregnant, then it can affect the babies. Sometimes nowadays they are saying that in some cases it can still cause miscarriage, because as we know, the COVID-19 patients have high temperature, and high temperature is not a good friend of pregnancy. The high temperature by itself can cause miscarriage, and that is why there is an indirect risk of miscarriage due to the high temperature someone has got. And if that systemic infection becomes very severe, and if someone is carrying a baby, especially in the late stages of pregnancy, it can cause premature labor. And if the baby is very premature, then it can affect the baby, because sometimes the survival may be in question as well. But as far as the fertility is concerned, I have attended few webinars, and nobody mentioned that it reduces fertility. Therefore, I think it doesn't have a direct effect on the fertility. I hope I have answered your question. Thank you for such an interesting question.
Our next question is, who can I talk to if I have any more questions or worries? Again, I can answer this. If you have questions or worries about anything, give us a call. You'll probably get put through to me, and we can have a conversation, and I can, if you have any questions about any of the treatments or about any worries or concerns, then I will always answer your questions. If I don't know the answer, I will always go to Dr. Venkat or to Darshi or to any of our clinical team. I will find out the answer for you, and I will come back to you and answer you. So it's a very open dialogue. So, I don't want anyone to be nervous about anything. If email communication is better, that also works for me. So if you do have any questions or worries, just give us a call, and we can discuss them. Can my partner attend fertility appointments? I'll pass that one on to Darshi.
So yes, like I said, if you have an appointment in the clinic, then yes, he can able to attend. So normally, sometimes the husband would like to come along with the wife when they're coming during the treatment, which we try and avoid, like I mentioned earlier, because we tried the minimum patients in the clinic. So therefore, we just say a yes and a no. If we have an appointment, yes. Otherwise, we try to not to. But if you really, really wanted to, then yes, talk to us. Like we always can help you on that. Thank you.
And then our next question, not COVID related per se, but how many IUI straws are typically needed for an IVF cycle?
Sorry, what is the question, Karina? Sorry.
So not COVID related per se, but how many IUI straws are typically needed for an IVF cycle?
Okay, so that means the frozen sperm we are talking about here, IUI straws. And in our clinic, for each IUI cycle and IVF cycle, we use 2 straws or 2 ampules. In some sperm banks, they call it ampules, and some places they call straws. Whatever it is, they take out 2 vials or ampules or straws and get lot of sperm, so that we get what shall I say, large number of motile sperm and healthy sperm. That's what we want, because if you have good number of healthy sperm, that the sperm will have a higher chance of fertilizing the eggs. You are likely to get more embryos in IVF. And if you have limited sperm, then fertilization chances will be reduced. Therefore, our embryologists believe that 2 ampules will give a better success rate, or 2 straws, and they always use 2 straws for IVF and IUI. And if somebody has got 1 straw, then we prefer to carry out ICSI or ICSI treatment. It is called intracytoplasmic sperm injection. That's why it's known as ICSI, where 1 sperm is taken and injected into each egg. And this is because we have minimal sperm. To maximize your chances, we inject the sperm into the egg. And so with the limited sperm, we recommend the treatment. But if you want good results with IVF and IUI, we use 2 straws.
Lovely. So I think that's all of our questions that we have. If anyone else have any questions or would like to reach out to speak to myself, please do. You can always book a call with me. If you go on our website, you'll be able to book a day and a time to have a conversation with me. So feel free to do that. And I think that's all the questions. I'd like to thank you all for listening and attending our webinar. And I'd also like to thank our panelists, Dr. Venkat and Darshi. And last but not least, also thank our technical moderators. And I hope everyone has a good weekend and a lovely evening. Thank you.
Thank you very much, Karina, Darshi, and Georgia.
Thank you.